Hi, my name is Shelby Norris, and I will be talking about the prevalence of herpes in the United States. So to start out, to introduce herpes, it is a STI that is caused by the herpes simplex virus, both 1 and 2. Herpes can result from an oral or genital infection. HSV1 is more common amongst orally, and then HSV genital, but it is important to note that it can be transferred back and forth, and they're interchangeable. In the United States, herpes is actually very common. Around 11.9% of people ages 14 to 49 have HSV2, while around 47.8% of people have HSV1. HSV2 is more common amongst women, and it is also more common amongst non-Hispanic Black peoples, while it is least common amongst non-Hispanic Asian people. Those numbers are 34.6% and then 8.1%. As for HSV1, the oral one, it is most common among Mexican American people and lowest amongst non-Hispanic white people. The other thing to note is it is said that over 87% of people may have herpes and do not know they have the diagnosis. So in summary, herpes is extremely common, but also a skin condition that can be infected amongst anywhere on the body.
Yes, herpes is an STI, but there also is the risk of becoming infected outside of sexual contact. One can become infected through oral contact, such as kissing, sharing utensils, or sharing oral hygiene products. Someone can become infected through skin-to-skin contact. Those who have open sores or have skin conditions such as eczema are more at risk for becoming infected through skin-to-skin contact. One may think that it is easy to prevent becoming infected with herpes by just avoiding those who are infected. But most symptoms can either be mild or inactive, making it hard to realize if someone is infected, even if that someone is yourself. Most symptoms may have people mistake herpes as another illness. Herpes can cause fevers and body aches, which may make someone believe that they have the flu. If someone sees a sore on their lip, they may think that they just have a cold sore when they may actually have oral herpes. If someone sees a bump on their genitals, they may think that they just have a hair bump when in reality they may have genital herpes. Mistaking herpes for another illness is very dangerous because it increases the risk of a person unknowingly transmitting their infection to another person. People infected with herpes can infect others through oral contact, skin-to-skin contact, and sexual contacts. Pregnant women have an additional risk as they can infect their unborn child. Herpes can be transmitted between different people, but it can also be transmitted between different body parts of the same person. One type of herpes can lead to a different type of herpes. For example, if someone performs oral sex on someone with genital herpes, that person can become infected with oral herpes. The same can happen the other way around. If someone receives oral sex from someone with oral herpes, they can then become infected with genital herpes. Herpes does not just run the risk of causing other types of herpes. It can also cause other STIs, especially HIV. Herpes being transmitted to another part of the body can come with more severe symptoms. If someone infected with herpes rubs their eyes without washing their hands, they have the risk of transmitting the infection to their eyes. If that infection spreads to their cornea, they can become blind. Although the initial symptoms of herpes is pretty minor, it can lead to more severe or life-threatening symptoms.
A few ways that a person living with herpes can reduce the stigma pertaining to it can be firstly by educating themselves on the type of herpes that they have, some symptoms, effective treatments that could be available to them. If they reach out to maybe a healthcare provider that might know more about it, that can give them more proper and in-depth details pertaining to it, finding people that they can trust and talk to, as a safe space, or creating a safe space or having a positive outlet pertaining to their circumstances. There are other number of support groups online and even face-to-face, but I believe it's also can be according to your state. There are a lot of support groups all around the 50 states. Some are Iowa, Florida, Ohio, even Canada as well. And I believe if you search your state and Google support groups by your state, they will send you to a link where you can do your research about what type of things that they talk about or who you can talk to. For example, there's a support group on Facebook called the STI Project, where there are a lot of people that are either living with herpes, different types of herpes, that are in relationships, that are open to sharing their success stories in the forums. You can ask questions about it. Another way to reduce a stigma pertaining to it is also by talking on social media, making videos about it based on the research conducted, and you can post the videos and it could reach people that relate or that don't know much about it. And another way is by getting regularly tested, going to the nearest clinic or urgent care in your city or in your state, and you can utilize other healthcare insurance resources that can be available to you. And another way is by advocating, speaking up, trying to petition for certain laws, getting people to be able to have the proper resources that may or may not be available to them, or being able to find health insurance options, make them cheaper, more affordable for those that may not be able to qualify, or it just depends on their circumstances.
Hi guys, today we'll be talking about the prevention of herpes. So first things first, a lot of people say this, but of course you can always abstain from sexual activities unless you know the full health of your partner. And also another thing that can help you out to avoid herpes is to, of course, use some type of barrier method to help you out. So like, for example, condoms. Condoms are not 100% effective, but they do offer some type of protection instead of none. So it's better to do that instead of having nothing. Also, too, if you're going to have any sexual intercourse or anything orally with your partner, make sure that you are both talking to each other about your sexual past and your sexual health. So make sure that you are going to take these tests together. Make sure you share the results. And I feel like that's the best way to know and to reduce some of that and to prevent herpes from spreading. Also, another thing is medication. So I'm going to try my best to pronounce. But we have medication like Activir, Vlaclavir, and Famotidine. I said that right. This can help reduce the frequency and the duration of the outbreaks, which can also help, when it comes to discussing with your partner, if you want to do anything to make sure that you stop the spread of herpes. Also, it would be best to avoid high-risk activities if you don't know the full history behind the person or the individual that you're doing things with. So make sure that you try to avoid like kissing, because not all the time it can be spread by sexual activity. This can be spread by sore to sore, by blister to blister. So just make sure that you be careful out there, that you stay safe.